Okay, we're going to start going through zone exercises for region 5, which is right around the thyroid. Remember, this is the communications center. And a lot of these exercises are going to be completely different than typical workouts where you're exerting a lot of energy. For those who get together with family during Thanksgiving, after that meal, you're probably not going to go do a kettlebell challenge and swinging, see how many snatches you can do in 5 minutes, but you may go for a walk. So in our last health talk about the thyroid, we talked a little bit about the parasympathetic versus the sympathetic nervous system. The sympathetic is the fight, flight, freeze, where the parasympathetic nervous system is the rest, digest. So the exercise we're doing is going to be more very slow, like walking, stimulating, improving digestion and the resting and things like that. So for this first one, we're going to do neck rotations. This is super simple, but nevertheless, you have to be careful if you've had any neck injuries or whatnot. So you may hear some crepitus and popping and things like that. So you may want to start with your rotations smaller. And for those who have dizziness issues, you may want to sit down and start, again, very little and work your way up. So what you're doing is basically just rotating your neck around in a big circle, if you can. And it's just like the ball of your head's kind of rolling around every little section of your neck. And that's the general principle. You're doing about 10 up to 20 rotations in one direction, then flipping it the other way. However, we're going to actually add a little bit more to it. So when breathing with this is, as you're going through the front area, you're going to be exhaling. That's breathing out. You could do it through your nose. You could do it through your mouth. I'll just, for this video, do it through the mouth so you can kind of see it a little bit. You're just... Then as you turn the corner, you start going back, you're going to be inhaling. And I normally encourage people to do it through the nose. Then exhale as you come around. Now, when you're doing this, there's actually a reflex with the breath. So say if you had a tight neck muscle and you're going through and it gets real tight as you're rotating, as you're exhaling, there's a reflex with letting the muscle relax. So if you do have those tight muscles, which many of you probably will have if you have thyroid issues, really work on trying to relax and even think about relaxing any tight muscle in that area. When you breathe in, your chest should go up, and you may have tight areas through there as well. Then as you come through the front, chest should go down and rotate. So when you get 10 one way, you can do 10 the other. You can work your way up to doing 20 reps. This is going to really help promote circulation and drainage of this through the neck area. Remember, this thyroid area is at the lower cervical level, so if anyone's had any injuries there, just be a little cautious. But this can actually help create some movement there, and it's a very important transition area where the upper thoracic and the lower cervical spine meets up. So if you have other body issues in that area, I may be showing some other things that will help improve your thyroid function.